Welcome to the Veterinary Rehabilitation Podcast, where we aim to help fellow veterinary rehab therapists increase their knowledge and elevate their practice. I'm Megan Kelly.
And I'm Anae Lloyd. Together, we bring you the latest insights, research, and information in the field of veterinary rehabilitation.
This podcast is brought to you by Onlinepethealth, a leading continuing education membership for veterinary rehabilitation therapists. With Onlinepethealth, you'll have access to a wide range of online resources to help you stay up to date with the latest techniques, advances, and trends in the industry.
Our podcast features in-depth conversations with leading experts in veterinary rehabilitation. They share their own experiences and knowledge to help you improve your practice. Whether you're a seasoned pro or just starting out in the field, our goal is to provide you with the tools and the insights you need to succeed.
So join us as we explore the exciting world of veterinary rehabilitation and help you take your practice to the next level. Hey veterinary rehabbers, in today's episode, Nairn from Pool for Paws is joining Anae in a discussion offering Carly's unique perspective as a hydrotherapist and the owner of 3 amputee pets. She has 1 with a prosthesis and 2 without. They explore the biomechanical adaptations and compensations that come with amputation, the benefits of using a prosthesis, and patient preferences around prosthetic use. They also dive into topics like phantom limb pain and the role of hydrotherapy in supporting amputees. Carly and Anae highlight some of the valuable resources available on the Onlinepethealth platform for managing amputee patients. One of them is a webinar by Marinette Teeling, also an article on phantom limb pain, and we also have a PLR product designed for pet owners to guide them through early post-operative care and help them recognize the long-term adaptations that they're going to need for amputee pets. Now, for those of you that don't know what a PLR product is, it stands for private label rights. Now, these are resources that are available in a PDF format, and they come with these private label rights, allowing you to edit, rebrand, and present them as your own. You can use these PDFs in various ways as gifts for clients, to enhance client compliance, to collaborate with referral vets, or as lead magnets to attract new clients, or even sell them on social media as additional income sources. Now, we offer 12 different PDFs and 6 posters, and they cover a range of topics, including hip dysplasia, elbow dysplasia, cruciate ruptures, iliopsoas, injuries, acupressure, and the amputee one. So if you're interested, you can go to www.onlinepethealth.com/digital products, and you can learn more about them and get started with your PLR products. Before we head over to the chat, a quick word from our sponsor. Nada first developed her courses at the Colorado State University, where she started the medical acupuncture for veterinarian certificate program in 1998. In so doing, Dr. Robinson developed a science-based platform for veterinary acupuncture, the first of its kind. Today, Curacao Vet offers a comprehensive curriculum in integrative medicine with a rational evidence-supported foundation. Courses include medical acupuncture, photomedicine, botanical medicine, medical massage, and integrative rehabilitation. You can discover Curacao Vet at curacao.org. Right, over to Anae and Carly.
Amazing. Welcome, everyone. Thank you so much for joining us today. Carly, thank you so much for joining me.
Hello, thank you.
Guys, so today we are talking about amputees and kind of the consequences that come with amputation that we might not always think about, but that we really do need to be aware of as vet rehabbers. So I want to say a big welcome to Carly. She and I have actually been chatting for quite a while about amputees, and I'm really excited to have her with us on this Facebook Live because she has a unique perspective. So Carly, can you please introduce yourself and tell us what your interest is in canine amputees?
Hello. So hi, I'm Carly. I have vast experience of. I was a vet nurse for about 20 years. I still am, but just not in practice. And I now work primarily in hydrotherapy. So I've always been involved with amputees from the surgical perspective when I was nursing. But 7 years ago, I actually took on my first amputee dog as a rescue, and we've had another 2 after him. So I currently have 3 amputees at home, and I find it very interesting being able to see it from the rehab perspective as well as an owner's perspective.
I love that. Thank you so much, Carly. So Carly, could you share from an owner's perspective, what are some of the challenges that you've seen for these dogs that you're owning that you might not have been aware of as a professional?
Yeah, I think from a personal perspective, from owning them, it's very much taking in the individual dog and how they've coped with it. So I noticed various different things with my guys, from how they cope with different types of flooring, how they can cope with stairs, both going up and down, how the speed that they walk individually has an impact on their ability. I have one of mine does wear a prosthetic leg, so obviously his walking is entirely different to the two that are missing their entire legs, which can make walking them quite difficult as well when you're doing it all at the same time. But yes, it's just looking at the different compensations as well, noticing what one may cope with and how they've compensated without any issues is very different to how one of the other ones is coping. And it's kind of looking at them as an individual, rather than just looking at them and going, oh, they've got three legs, they cope absolutely fine.
So what are some of the coping mechanisms or biomechanical adaptations that you've seen in your dogs?
In my own dogs, all of them had their amputations before I got them, so I've not had them from the initial surgery themselves, although one of them was not long after the initial surgery. So a lot of the time what I tend to see in them, you tend to see a lot of compensation in the diagonal limb, to the amputee. What you tend to find is in the thoracic limb amputees, you're probably already seeing about a 70% compensation increase in weight bearing on the remaining forelimb, which obviously is a massive increase there straight away. And with the pelvic limbs, which all of mine are pelvic limbs, you're already seeing about a 33% shift of weight to the contralateral limb as well, which I've seen by putting them on a stance analyzer to just see exactly where things are changing, and where they're shifting their weight through to. But the studies go that within about 10 days of them having their leg amputated, they are already making compensatory changes. So by the time that all of my guys have come to me, they are already well into their compensatory stage. And I'm sort of seeing things like, I have seen a lameness on the contralateral limb. My boy that has the prosthetic leg is already starting to get arthritis in some of the toes in the foot on the contralateral limb as well. So yeah, it's quite interesting seeing where they're shifting weight through to all the time and the effects it can have on that as well.
How often is your guy in his prosthetic versus without his prosthetic during the course of the day?
He's a funny boy. He doesn't like his shoes on at home, as we call it. So when we're in the house, he prefers not to wear his leg. As soon as we're out and about, as soon as we're out of the house, he wears the leg. So it depends. We might be out for an hour. We could be out all day, and he'll wear the leg. He can wear the leg for up to 14 hours a day.
Okay, nice. So you've just said he doesn't like it in the house, but he does want it whenever you go out. Does he have like an opt-in? How does he let you know that he wants his leg?
As soon as we get back in the house, he holds the leg up. And he literally holds it up as if he's like, shoes off now, please, I'm in the house. And I think he just feels a lot more comfortable moving around the house without it, because he's laying down a lot. And obviously with it being a solid prosthetic, it's sometimes not as easy for him to just sit down in it. Whereas when we're out and about, he's off doing things, he's mooching around. So he's actually physically using the leg a lot more.
I love that. Thank you. So Charlotte is saying that those are two things that my dog could never do again: slippery floors and stairs. Even with physiotherapy, he didn't have the confidence to do them. Thank you, Charlotte. So really, for me, that's highlighting, what are we going to take to our owners and say, like, which environmental adaptations do we need to make sure that your dog can still live in your home and be comfortable in your home? That's a big one. Karen, thank you for joining us. It's good to have you. Veterinary physiotherapist here too from the UK, interested to learn from your experience. Haven't ever had to see an amputee in practice, but we have had an amputee yard cat at our stables. I think cats are really interesting, actually, because the few amputees that I've seen, the few feline amputees that I've seen, they have really significant changes in the way that they're moving. So like much lower to the ground. They'll kind of be in a crawl a lot of the time. So they're still functional, but they're moving completely differently. So I'd love to know if you guys have had the same experience with cats and how they cope with amputations, because there's definitely a difference there, which is interesting. Do you have any experience with cats, Carly?
Not from the rehab side. I don't get to see many cats at the pool. I have had dealings with them from the surgical point of view when I was assisting with the surgery. But from looking at how videos of amputee cats and how they move, you can see the compensatory effects very similar to how dogs do. You tend to find that with the remaining limb, they'll tend to, as with dogs, bring the limb further in underneath themselves. So they're not standing in obviously what would normally be a four-leg stance. They're bringing that leg in to try and compensate more, to give themselves some more balance. I see that a lot of cats, and again, you do tend to see them, particularly if it's a forelimb that they're missing, you do tend to see them a bit more hunched over when they're sort of sat or stood up. They tend to have a lower posture on them.
They're very interesting. Amy, welcome. It's great to have you with us. Also a hydrotherapist and currently one with forelimb and one with hind limb amputation. That's awesome. Thanks for sharing that, Amy. Julia, it's great to have you with us. Also vet physio in the UK, working with small animal patients in second opinion practice. Guys, it's so good to have you all with us.
Hello.
Really great to have you. Share any questions that you have and we'll discuss that and go through that. Okay, so you mentioned earlier that you are not seeing amputees right at the beginning after an amputation, but rather they've kind of lived with an amputation for a period of time and have developed some issues. So what are some of the ways that what are some of the things actually that you find in their bodies? So what are they dealing with after having an amputation for potentially a few years? How are they feeling and coping, and what have they developed?
It tends to be, depending on whether it's the thoracic limb or the pelvic limb they're missing, tends to see on what compensations you're getting. You tend to see, if you're talking about the thoracic limbs, you're seeing quite a lot of lordosis in the spine. You get a dropped scapular sling on them. You're getting, again, a very much a crouched position, like I was just saying with the cats. Carpal, I cannot go on enough about carpal issues, whether it's a forelimb amputation, hind limb amputation, the carpus takes an awful lot of pressure through it. So I've seen quite a lot of cases where the carpus on either the remaining leg or the contralateral limb has started to hyperextend because of so much pressure that's being put through it. And then that's kind of looking into a whole different ball game of rehab and trying to help things with that. In regards to if it's a pelvic limb amputation, what you tend to see, I quite often see, again, a little bit of sort of lordosis of the spine, but they also tend to stand with the spine to the side, towards the direction of the remaining limb, almost as if they're just trying to get the balance right. And obviously that then is going to be causing compensatory issues along the spine, or along all the soft tissues and the musculature along there as well. So I quite often see quite a lot of back issues with amputees that are coming in quite a way down the line. And again, with the pelvic amputees, because you tend to see more of a tilt in the pelvis, it's putting the stifle and the tarsus under much more pressure on the remaining limb than you'd normally see.
Yeah, that carpus is definitely an interesting one, and I would almost want to have amputees in a carpal brace from very early on, right? If they're being active, if you're going for a walk, wear a brace and support the carpus a little bit.
Yes.
So what other support are there ways for us to support them? What are some of the things we can use to support amputees to make their life easier, and to kind of prevent degeneration?
Yes, I think it depends on the individual dog, how close they are to the amputation, how far you are down the line, and what compensations happened already. If they've already got osteoarthritis setting, that's the big one that I tend to see, is we're not seeing them until 6-7 years down the line. by which time the arthritis has set in. So you're dealing with a lot of issues. With my guys in particular, I walk them in harnesses that have handles on the back. So what I tend to find is if we're out all day and they are getting tired at all, I can actually support them with just the handle on the harness, just to take a little bit of pressure off the legs, to make it easier for them to walk. Again, with Skip, my boy, he's got the prosthetic leg, which takes the pressure off. I actually did a test on him with a stance analyzer I put him on the stance analyzer, which I don't know if everybody knows about them, but it measures the percentage of pressure each dog's putting through each leg. When he wasn't wearing his leg, he was pushing all of the weight through to the right-hand side. He's missing his back left part of his leg. When I put the prosthetic leg on him, he was perfectly balanced the whole way round, which obviously makes a massive difference going on long term for his other limbs. So yeah, I'm a big fan of those sorts of things. Slings, if it's quite close to to the surgery, sort of using either slings under the chest, slings under the belly, if they're getting used to changing their center of balance, and trying to get used to how they've got to move about quite close after the amputation. Mine is quite a useful tool as well.
Yeah, those are all great. Thank you. I find it really interesting, the prosthetic. I've never worked with an amputee with a prosthetic, but you shared a video with me yonks ago of your 3 dogs walking, and the difference between the dog with the prosthetic and the ones without was massive. You know, you're looking at essentially a normal gait with just very slight adaptations, because there is a difference, versus a completely different adapted gait to being 3-legged. And that's really significant. And so it's quite, if we can have prosthetics, we really should try and go that way. But as we have professionals, right, the only way we get to weigh in on that is if we're a part of that initial decision-making process and in discussions with the veterinarians. And of course, it's not always possible. So there is also that aspect. So we have some really good questions. Charlotte, I'm going to start with Rebecca, and I'm going to come back to the phantom nerve pain, because I do want us to talk about that. Rebecca, welcome. It's good to have you here. Also a animal physio from the UK. So you're asking for videos of an amputee on the treadmill or in the pool, and which rehab tools for these cases. So we haven't prepared any videos today, but we might be able to share some in the comments later, which is fine. Let's chat about that pool versus underwater treadmill, and how each one impacts the dog, and how we keep them safe as well, right? If we're swimming with them, how do we want to make sure that we're not getting rotation or putting them at risk in the pool?
Yes, my preference for amputees is purely the pool. I find with the amputees, I've actually got quite a good video which I can send and share in the comments of one of my amputee girl walking on land, and you can see how restricted she is in the movement of the amount of stretch she can get on her legs in the steps to keep her momentum and balance. In the pool, they are totally weightless, which means that the extension and flexion they can't do on their legs in land, they are then able to get in the pool. So they're then able to get the muscle built up a lot better. You're getting good core strength building. And I tend to find it's a good all-round muscle building rather than focusing on specific areas for them. I personally haven't put an amputee in the treadmill. I have seen videos of it. And having watched my own amputees walk, particularly the full leg amputees, they have to walk at a quicker speed because they have to keep that momentum going to kind of make up for that missing limb, because they will always still try and put down a limb that's not there because it's a natural movement for them. And I don't think we can recreate that in the treadmill. I find that the videos that I've seen, the dogs really look like they're struggling. And I kind of think they've got to struggle because they're on 3 legs anyway. So why do we want to make it harder for them? For me, I feel the pool is always the way to go. I always make sure they have a flotation jacket on, just because I feel that it does help with trying to keep the balance up a little bit more. The main one that I have in at the moment, he's a four-limb amputee, and to start off with, I did have a little extra flotation part on the side of the jacket that he was missing to keep him up, to keep that side upright so he wasn't going to rotate round and balance off. And over time, I've actually removed that, and he will now swim in a straight line. I get good extension on the legs, and he generally he swims a lot. He swims and stretches out a lot better he can do on land. And that's why I love using the pool for them.
I completely agree with that. For me, the underwater treadmill with an amputee is generally a contraindication. I think it's one of the few patients that the underwater treadmill isn't a modality that's on the list that I want to be using. And if you want to kind of go more into that, Julia, or really anyone, we had an interview with Angela Griffiths, I think it was last week, where we discussed the underwater treadmill. And this is one of the things that we discussed. And Angela went into quite a bit of detail on why we would not want to use the underwater treadmill for an amputee. So if you want to listen to that one, you're welcome to. But it is a very interesting one. Okay, let's see. So Charlotte is asking about phantom nerve pain. Have you ever experienced this with an amputee, Holly?
I have seen it in one dog. It was many years ago when I was still back in veterinary practice, and it actually was probably one of the most saddest things I've ever seen. The dog would literally stand there and attack the air underneath where the leg would be, and we tried various nerve analgesics. We'd tried a lot of medication for the dog, and unfortunately nothing worked, and he was unfortunately eventually put to sleep for his own welfare. I'm lucky, touch wood, I haven't seen it in a dog since. I know there's studies that have been done on it. I don't think, as far as I'm aware, I could be wrong, I don't think there is kind of conclusive reasoning as to why one dog's going to get, or any animal's going to get, phantom pain syndrome over another, whether it's down to how the nerves have been cut when it's been amputated, whether there's been already nerve damage there. I don't think they know definitively. I'm like I said, I'm very lucky in the ones that I've seen. I haven't seen any signs of phantom pain syndrome. And in the dogs that I've read about it on and seen that one dog, it's literally like what leg should be there in their brain is intensely painful, even though the limb's not even there anymore. And it's like the fast triggering, firing off of those nerves, giving the pain signals for a limb that doesn't exist anymore.
It's really horrible if it does happen, because there's very little that we can do to change that. And it's the same. It's the same with people. I don't know that there is a good treatment that actually deals with or takes away the pain if phantom limb pain occurs. So I love that you asked that, Charlotte, because it really is relevant. It does happen. We have a blog post about it, actually, because the research article that was published on it, I think there's only one. I summarized in that blog, so you can go through that. I'll put that in the comments for you so you can have a look. And we have a webinar that Marinette Thielen goes into that as well in the Onlinepethealth membership. So I'll link that as well for you guys. But it is really interesting. Yeah. Okay. So I've treated a lot of canine amputee patients over the years, but not seen any or had owners keen on orthotics, sadly. How often do you see patients with a prosthetic? Yeah, Julia, that's my experience as well. I've never had a prosthetic amputee. Yeah.
To be fair, my boy's the only prosthetic amputee I've ever come across. It was the charity who rescued him. His was actually taken. The lower part of his leg was taken off in a snare trap. Because I work with them quite closely, they said to me, "Do you want to try a prosthetic? Do you want us to amputate the rest of the leg?" And I kind of thought, well, it'd be a shame to take the leg off when it's still there, it's still functional. Let's give it a try. So basically, I was put in touch with a company in America who made the leg bespoke for him. And as you say, you've seen the video of him. I would like to see more dogs having prosthetics. Full limb amputees, it is possible to get a prosthetic leg for them. What you tend to get is you'll quite often get a cage that goes over the rib cage itself with the prosthetic leg attached. So they use it kind of more as like a hopping prop as such, like a crutch that they can use. If they've still got part of the front leg left or part of the back leg left, you then can get a partial prosthetic. I am in talks with another charity with a dog that's just come over from Spain that had part of his lower leg ripped off in a dog fight, and we're looking to try and get a prosthetic sorted for him once the stump's all healed. Back leg, if you've got a full hind limb amputee, as far as I'm aware, there is no available prosthetic for a full hind limb amputee, purely because with the hind legs and the way the hind legs are used, obviously they're used for propulsion, they're used for movement up and down. You need part of the normal neurological function of a limb to be able to get that prosthetic leg to work properly, which we can't recreate if there is no pelvic limb left.
Yeah, I think even with the forelimb, the more leg you have left, the better the prosthetic functions. So the full forelimb kind of crutch isn't ideal.
No,
but
it's not the best. It's an option to at least try and take some pressure off the other leg. I was actually in discussion, and this came as a total fluke from a Facebook page, an amputee page that I'm on, and it was actually a lady in America whose dog had injured its foot. It had a bit of metal that went up through its foot. Foot became all necrotic, and the vets wanted to amputate the leg. And she was asking about if anybody had any experience of prosthetics, so I kind of piped up with my boy, and we started chatting about it. And it's like I said, if our hand got crushed, would a surgeon amputate our whole arm for that sake? And we were chatting about it, and she was very keen to just have the foot amputated. Vets were very much worried about the stump healing. Long story short, the vets did actually end up agreeing on doing a partial amputation. Within 12 weeks, he was in his new prosthetic leg, and I've seen videos of him since, and he is doing amazingly well. And I kind of think that's actually is more of a salvage technique for me, because I think you're actually salvaging the limb, as much of the limb as you can, rather than just taking everything away when it's actually still healthy, viable limb.
Yeah, and then you have the option of having a prosthetic, whether you're able to pursue it or not. At the end of the day, the option is there, and I think that's what we're doing. I think it's very interesting that you mentioned that. So your boy likes to have it off when he's at home. Yeah. And that's interesting because there are prosthetics that they implant. So when they do the amputation, they implant a permanent prosthetic that stays there, that you're not moving and putting back on. So that's also something that can be done.
Yes.
I haven't had any experience with it myself, but I know that that's available. So just in the back of my mind, would that always be ideal, or is it better to be able to remove it for the comfort of the patient? They might not.
I think it kind of depends on the case at hand. My personal worry, and this is coming from, I think, my experience of vet nursing, is that when you're putting an implant actually into the bone, like you are with the permanent prosthetics, there is a risk of infection going up into the bone, because obviously you're putting something that isn't meant to be there in there. I have seen that once in the past. This was quite a few years ago, that with a permanent prosthetic that was trying to be done, and it ended up failing massively because the bone just kept on getting infection in it. My other worry would be if it's there all the time and the dog's running around, they happen to, you'd hope not, but if they happen to fracture that bone, that's kind of the whole prosthetic gone. And then you're kind of looking at salvage techniques again. Whereas what I found from the personal views with my own boy, he can run on that prosthetic leg, he can walk on it, he can do pretty much anything he wants to do. But when he wants to lay down and go to sleep and it's a lot more comfortable for him, he can have that leg taken off. And actually, when I first had him and he didn't have the prosthetic, he would try to put the stump down, and his stifle would abduct out, his spine would really curve around. Because he's now used to wearing the prosthetic when we're out and about, when he doesn't wear it at home, even now when he puts his stump down, he still walks totally straight. It's totally changed how his gait has become, because that's what he's become used to.
Wow, thank you. Okay, so Karis, thank you for your comment. I'm not familiar with the surgical techniques in canines, but from my time working in vascular in the human world, the calf muscle is often used to form the flap that comes under the limb and creates the bottom of the stump. So people sometimes complain of calf pain, which in a way they are having. It's just that their calf is now where the brain thinks the calf is no longer where the brain thinks it is, right?
Yes.
So that's a very good point. For those of us that are not familiar with the surgical procedure of an amputation, Carly, could you walk us through like some of the most common? So, what is the most common amputation for the front and the hind limb, and what should we know about that procedure as rehab therapists?
Yeah, I think what you tend to find is it comes down to the vet's preference. And what they find is a good technique. The forelimb, I find some vets will prefer to take if they're going to do a full leg amputation, they will remove the scapula as well, and not leave any part of the remaining leg there. What you'll find is some other legs will actually leave the scapula in place. They say it's because it's giving the rib cage some protection. I don't know if there's much evidence that actually it makes much of a difference to that area. So they'll leave part of the humerus in place. If you're looking at doing a prosthetic, that might give you a little bit more to actually attach something to. My worry, and what I have seen in the past, is actually some dogs then actually do damage that part of the stump that's left below the scapula with that part of the humerus, because they are still trying to use it a fair bit. Whereas if the scapula has been totally removed, there's nothing there left to really damage or do anything to. Hind limb, generally as a rule, again, it's
sorry, Carly.
Sorry.
If they remove the scapula, how do they deal with the brachial plexus?
To be fair, a lot of the surgeons I've seen, they will ligature, they will put a ligature around it to basically sever it. I've never seen a dog with phantom pain syndrome from a forelimb amputee, which you'd kind of think you would with a brachial plexus, being disturbed in that way. But yes, the vets that I've worked with in the past, they literally ligature around it, and then we'll cut through the end of it from there. With the hind limbs, the majority of the vets that I've ever worked will remove the whole hind limb, including the femoral head. So you're literally left with nothing but the pelvis there, and then they'll bring fat pads underneath to then, basically give a little bit of cushioning to the area. I have worked with some that, again, will, a bit like the scapula, they will remove part of the limb going up to kind of maybe the top third of the femur and leave that in place. But again, I tend to find if they lay down a lot, if they sit down a lot, it's kind of a stump to keep on bashing on the floor. But it is, over the years I've worked with vets, it's very much down to vet's preference.
Okay, interesting. Awesome. Thank you for sharing that. Okay, Rebecca, I'm currently fostering a front limb partial amputee, Husky Cross. His amputation was 6 months ago at the proximal radius ulna, just below the elbow, following a snare trap injury. Because he can still extend his elbow, he hasn't fully adopted the tripod gait and will weight bear at the level of the elbow when walking slow or turning, resulting in a really low head position when mobilizing. However, I think a prosthetic is not possible because the amputation is too high. He has hydro and physio, but I can't see the rest of that comment. So that's actually his gait is worse because he's using the stump.
He's trying to go down on the stump.
That's very interesting. Do you have any thoughts for Rebecca?
It would be worthwhile getting in touch with a prosthetic company. And just seeing, because those are the guys that are making these things day in, day out, as to whether there is enough of a stump left to be able to do it. Were you just saying that there was still part of the elbow joint there, they were saying, weren't they?
Yeah, so just below the elbow at the proximal radius ulna.
Yes. Yeah. So in theory, from when Skip had his, the prosthetic company was saying if you've got about 2 centimeters of a stump below a joint, then they are eligible for a prosthetic, because you've still got all the normal neuromuscular movement there. If it was above the elbow, again, it would then go on to like one of those crutch ones, because you haven't got the flexion of the joint. So it would potentially be worthwhile getting in touch with a prosthetic company and seeing. The other option, I think, for the sake of the dog, would be to remove the rest of the stump, because otherwise he's going to continue, because he's got that part of the stump left. If he's not eligible for a prosthetic, or you don't want to go down that line, he is going to continually go to put it down, because for him, that's part of his leg that he's got there and he needs to use it. So I kind of think if they are left with any form of a stump, to prevent compensation and any issues happening later, take the stump out, because it's going to cause more problems by leaving that stump there.
Perfect. Thank you. So yeah, Rebecca's saying any other tips or suggestions, and I think he will ultimately need a revision for limb removal. So hopefully, Rebecca, there's enough under that elbow to fit a prosthesis. That would be the best thing. Amy, one of my clients is a vet whose dog has had the amputation, and they're so amazed how the hydrotherapy has helped that their practice is now referring as soon as the wound is healed, which is fabulous.
Absolutely perfect. Yes, that's what we want.
That's what we want.
That is the ideal.
Like I said, guys, I really love the amputations because I think there is a lot that we can do. And for that reason, we've created a PLR product for amputees. And if you're not familiar with our PLR product, basically it's a little ebook. It's a PDF ebook that is completely editable, which means you buy it and then you rebrand it so that it's your own. Any information that I've put in there that you don't agree with, you can change and edit to make your own. And then you can do essentially whatever you want with that little ebook, right? And what I love is you can give that to vets so that they pass it on to owners post-amputation or pre-amputation, because it covers the initial post-op period, how to prepare for that, what to expect, all of that is in there. So you can give that resource to your vets, which means they're more likely to refer to you, right?
Yes.
Or they don't have to refer to you because the owner's going to have this thing in their hands that's going to give them all the information that they need, and then they're going to come to you for help because they'll be able to recognize when they need it. So that's the first way that I like to use it. Secondly, you could sell it. So really, you could do whatever you wanted with it. So I'll share that with you guys in the comments as well, because I think that's a good way for us to start bringing that education to vets in a very in a subtle way. It's really us giving them something to add value to their clients' lives, which they always want. So I think that's a good thing to do. All right, guys, thank you for joining us today. It's been amazing. Carly, is there anything else you want to add or share?
I don't think so. No, I just, thank you everybody for joining. I'm so passionate about amputees, and I just, if I can get any words out there to try and help, even if it changes how one dog's treated and, how people think about it and how they want to promote, how amazing these dogs are and how we really, they really deserve our help. To make their lives that much easier, it's great, and it's fab that we've had you guys join us today.
I want to say a very special thank you to you, Carly, because Carly's actually sick, so she's joined. I convinced her to dose herself with medication so she could still join us live, which I'm sorry isn't always the best thing to do. I hope that you can get a little bit of rest, and I really appreciate you taking the time out of your day to chat with us. Very interesting.
No problem.
Awesome. Guys, thank you. Have an amazing day.
Yes. Have a good day.
If you enjoyed this podcast, please hit the subscribe button so you get notified every time I load a new podcast. I'm here every week talking to vet rehab therapists from all over the world about all things vet rehab. A big thanks to our sponsor, Curacao Vet. Their sponsorship allows us to be able to give this podcast to you for free, so please go and check them out at curacao.org. Please also don't forget to bookmark the next Vet Rehab Summit. It's on Saturday the 8th of November in 2025. Come and be a part of the world's largest online veterinary rehabilitation conference created specifically for you, the vet rehabber community. Onlinepethealth members, you get VIP complimentary access to the Vet Rehab Summit. For more information about continuing education for vet rehabbers, you can go to onlinepethealth.com.